Okay, so let's launch in. We're going to be talking, like I said, about the substance use risk profile pregnancy scale. And before we do, I just want to ask the question, because I'm sure you've been thinking about this a little. First, I'm going to ask the question, why screen? Why are we going to screen women, pregnant women, for substance use? But before I do, what is a screening? What does it mean to screen? What words come to your mind when you hear the word screening or screen?
Filters.
Louder?
Filters.
Okay, filter.
Filtering out who needs and who doesn't.
Okay, great.
A tool to assess risk.
Tool to assess risk. Anything else?
Questions.
Great. Anything else? Prevention. Okay. Is a screening tool diagnostic? Is it going to tell us if a woman is definitely using? Okay, no. Okay, it's going to give us a sense of who's at risk and who we need to take another step with. So when we're thinking about substance abuse screening, and this may seem like a no-brainer kind of a question, why screen pregnant women for alcohol use during pregnancy and other substances? Early intervention. Say what you mean by that.
Catching it as soon as possible to do something about it, whether it's to help the mother or help the child.
Okay, so catching it ASAP. Why else do we screen?
Education.
Okay. When you say education, what do you mean?
Well, it's an opportunity to provide education.
Okay, great. Just asking the question sets up something, sets up a context for being able to move into education, providing resources, providing information. Why else?
Safety. Excuse me. Safety.
Okay, say more.
Safety for the mom and for the baby.
Okay. And when you're thinking of safety, what are you thinking of specifically?
Excess alcohol and the consequences of that for the mom and the baby, be it either driving, be it either physical effects of overuse,
Okay.
the effects on the baby.
Okay, great. So we're thinking of the medical and health effects on both mom and baby, as well as kind of environment or context, driving, etc. I just saw another hand. Go ahead and.
I was just thinking of a mom who's a chronic user who tried to quit on her own.
Okay.
That was definitely a risk to her.
So
If she was a heavy alcohol user.
and tried to quit on her own. So providing support or assistance to people so they can actually be successful rather than doing it in ways that may be counterproductive. Any other?
I'm thinking of co-occurring disorders.
Okay.
So it also helps us understand what else is going on. Is this appropriate behavior?
Great. Okay, it can be an entry into other things that are happening, and we'll talk about that a little bit.
I mean, I think one of the reasons why you screen and not specifically about this tool is that it gives you a beginning.
Great.
Is that you know where you're at, so it gives you a place to go.
Okay. Gives you a beginning, a jumping off point.
Yeah, baseline.
I think some of our own goals, those are taken to our kind of prevention or treatment.
Okay. It gives us the opportunity to make that decision where we are in the cycle. Okay.
The one thing you might touch on while you go through, but one thing I'm really curious about is the motivational approach with the screening.
Okay.
In terms of, I end up seeing a lot of screens done, and a lot of them, look too good.
Yeah.
Do you know what I'm saying?
Yep.
So then, wondering a lot about it's how we're joining and really working with that screening tool that's
Yep.
going to get us, like, where in the point of care, or how do we position? Because some of those I see, I just think this looks way too good to be true.
Right. That, if I just ask these 3 questions and they answer and I have their answer and I have a score, then they're going to get better. Right. Okay. And we will talk about that. And we'll talk a little bit about brief intervention also as well. And some ways that parallels with motivational interviewing, or how you can bring that in. Is that pretty good for right now? Okay, let's kind of jump in, and more things may come up. I'm going to just talk a little bit about some numbers and statistics. Oh, actually, before I do, let's ask that question. What does a woman who uses alcohol or drugs in her pregnancy or during her pregnancy look like? And don't say anything for a minute, but just jot down some words. Just imagine who comes to mind when you hear that, or when you hear that question. Okay, any responses to that? Yes.
Any woman.
Okay, is that pretty much what everybody? Okay, you guys are already in the room. Okay, anybody. And that's one of the reasons that we screen, and one of the reasons that we screen universally, is because we don't know. I think some of these, whoops, did I move ahead? Stats kind of point to that. 6 to 10 women, and these are from the Centers for Disease Control stats. You can find more online very easily. But 6 out of 10 women of childbearing age, so between the ages of 18 and 44, use alcohol, use some alcohol. Slightly less than a third of those who drink alcohol in this age group binge drink. We're going to talk in a minute about what we mean by binge drinking. About 1 out of 20 women drank excessively, and we'll talk about that also, before finding out they were pregnant. And in 2008, about 7.2% of pregnant women apparently use alcohol. Now, other studies say it's as high as 15% of women who use alcohol during their pregnancy. If 6 out of 10 women of childbearing age are using alcohol, then the likelihood of women using alcohol during at least the initial stages of the pregnancy is high. Why? They don't know they're pregnant yet. Okay, so the rates of alcohol use are pretty high in women. And many, many women, 6 out of 10 women, that's a pretty high, 60% of women are using alcohol. How much alcohol is too much during pregnancy? They don't know. Any other responses to that, or do you want to say more about that? Okay, anybody differ on that? I hear a lot more people saying any alcohol during pregnancy is too much.
I think we all tend to, in early childhood probably believe that. I think that when I listen to other people in the world talk about alcohol and pregnancy, I've heard it's okay to have a glass of wine. It's okay to, I've heard a lot of things like that come from moms.
Okay.
My doctor told me it's okay to have a glass of wine.
Okay.
Even things like that.
Right.
So.
And a lot of women are saying that. A lot of doctors are saying that. A lot of, do most of the women that you work with believe that any alcohol during pregnancy is too much? Most of them do.
No.
Okay.
I don't know, not for my population. I don't.
Okay, I see some shaking heads, some, yes.
I think it has a lot to do too with the cognitive mind, and I mean, so in theory you can know what's right for you, and my behavior is going to not fit that.
Okay.
So I can know that it's really, this is what's suggested,
right,
that I should do this and this and this, but my right to know what's best and to practice that
can be at a disconnect. So let's actually talk, and I think we started to get at this a little bit earlier. What are the reasons that women may use alcohol or other drugs during their pregnancy? Let's just list some of them.
You mean moms that know they're pregnant or moms that don't?
Even moms that know they're pregnant, just in general.
Self-medication.
Okay, self-medication.
Stress.
I want to hang on to this one really quickly. Self-medication for, okay, depression. What else? Anxiety. Stress. Okay, mental health issues. Trauma. Past trauma that maybe has not been fully dealt with. Okay, so there's a lot of women who may be self-medicating. Why else do women use alcohol or other drugs? Okay, addiction. Maybe they actually have an active addiction. Denial.
uneducated.
Okay.
I've had women use alcohol or drugs because they wanted to terminate. So they
Okay.
use excessively to try to end their pregnancy.
Yeah, and we definitely ran into women like that in the context of the FEET project as well. So a desire to terminate the pregnancy. How many of you have a glass of wine every so often? Why do you have a glass of wine? Okay, social, it's a social thing. Okay, to unwind. For pleasure. Any other reasons?
I think for teens it would have a whole lot more reasons, like peer pressure, things going on in their lives.
Okay, could be peer pressure. How many people besides me come from at least half of or at least half of my family is Irish Catholic? Why else do you drink? Because you can. Maybe it's cultural. Maybe it's part of the culture. Maybe it's part of the family system of how we socialize, how we interact. There's a lot of reasons that women may be using. Yes.
I'm just going to add that I've heard stories of women using and continue to use in pregnancy because their partner pressured them. And
Great. Right. And in fact, you know, when we did our work with FEET, that was one of the primary obstacles to women stopping was a partner's use. Okay. So just important to remember again, and you all know all of this. It's kind of, I'm seeing a lot of this as probably review of stuff that you're already aware of. But that when you're screening a woman, she could be one of those 6 in 10 that are using during, or have used during her pregnancy or have used at all. And there's a whole bunch of different reasons that she may be using. And some of them may be very easy to kind of say, hey, wait a minute, not a good idea right now. Like social or lack of education or to unwind. You may be able to kind of find ways around those. Some of them may be harder, and she may need more intensive or a different kind of assistance if it's for purposes of self-medication, if she's dealing with mental health issues or trauma. Just something important to keep in mind. We don't know who these women are until we've entered into the conversation with them. Okay. Oops, something happened. Okay. All right, I just want to talk, again, I'm kind of assuming this is review, but just the Center for Disease Control guidelines about what is a drink. And this will be helpful as you're doing your screening, that we have kind of a common language about what we mean by a drink. And I probably could have asked you all of this as well. So a standard drink, we're referring to 12 ounces of beer, 8 ounces of malt liquor, 5 ounces of wine, or a shot, 1.5 ounces of 80 proof distilled spirits or liquor. That's a mouthful. That means something like gin, rum, vodka, or whiskey. That's what we are talking about when we're talking about a standard drink. Any thoughts, questions about that? Okay.
I'll just say that's not always the serving size.
Right. That is not always the serving size. And that's a good thing to keep in mind. And it might be something that you want to clarify when you're asking about a drink. Well, what is a drink to you? What do you mean when you say a drink? Yes?
I think a lot of people misunderstand, too, that 12 ounces of beer is the same as a shot of alcohol. I know a lot of people that have been through treatment that realize that after, hearing those stats, but prior to them, they think, oh, beer, that's nothing.
Right.
To hard alcohol or
right.
something else. So
that's a good point.
They are equal.
They are getting the same amount of, yeah, thank you. Anything else? Okay. CDC guidelines about women and heavy drinking, or women and alcohol in terms of heavy and binge drinking. Heavy drinking, the CDC defines heavy drinking as consuming an average of more than 1 drink a day. So an average of more than 1 drink a day is considered heavy drinking. Does that surprise anyone? Yeah. It's 1 drink a day seems like a lot. Okay. I've heard people say the exact opposite. Well, 1 drink a day doesn't sound like a lot. I have a glass or 2 of wine every night to unwind. Okay. So important to remember. Binge drinking is considered a practice of consuming 4 or more drinks on a single occasion. This is for women. Generally within 2 hours. And enough to elevate the blood alcohol content to about 0.08%. So depending on the size of the woman, that may vary a little bit, but that's sort of the general guideline. I think something that we didn't say, and I just want to add to this list, is I think it really determines, how we think about drinking and how we think about too much, how we think about what's binge, what's heavy, is just values. And that we're all coming at this with different values around drinking, around alcohol, around drug use, around pregnancy. We come from different cultures around it. And so just not necessarily right or wrong, but we just come from different perspectives, and having a common language that we can use, at least as professionals, can be helpful. Yeah?
Is the definition for men very different?
It's 5, I think, is for men.
Is the heavy drinking the same though?
I think, you know what? I didn't look at the heavy drinking for men. So I'm not, does anybody know the answer to that? It's 2 for men? Okay. Yeah, it doesn't seem fair, does it? Depending on. Okay. So alcohol use during pregnancy. Let's actually talk about this. What are the risks to a pregnant woman and her baby of alcohol use? You started to say them already, but what are some of them? Throw them out there. Fetal alcohol syndrome or fetal alcohol spectrum disorder. What are some of the symptoms of that? Okay, it could be if it's FAS, could be physical facial features distortion. What else? Okay, mental retardation. Some social emotional issues. Hyperactivity, difficulty with impulse control. Academic issues, behavior issues once kids reach school age. Okay. Anything else? Okay. So one of the reasons to screen, obviously, is we want to prevent FASD. Alcohol use increases its risk. It's completely preventable. Stopping as soon as possible, even if a mom's already been using. That's an important thing to say to a mom, if she's anxious about, well, stopping now is going to help reduce the risk. We don't know whether there's been any impact. We want to make sure there's not, so we can stop right now. Increased risk, and I should have waited for you to say this, but of SIDS, sudden infant death syndrome. So the risk substantially increases with binge drinking during the first trimester. How many of you are actually connecting with moms during the first trimester? Okay, so some of you are. Okay. And then finally, excessive drinking during the first trimester also increases the risk of miscarriage. And as Cindy was saying, it's can be one of the reasons that women are drinking in the first place, because they either consciously or unconsciously don't want to have this pregnancy continue. Excessive drinking may also disrupt menstrual cycling, increase the risk of infertility, miscarriage, stillbirth, premature delivery. Those are all impacts along the reproductive cycle for women. And it can be new information for women to know that. Anybody want to add anything?
It sure seems like if it increases the risk of infertility, we see a lot of women that are pregnant and drink.
Well,
yeah, that don't.
It's true that
drink a lot. Like really? Because they all.
Well, and it's you think about the counterbalance of that. It may increase the risk of infertility, but then it also decreases the inhibitions to having sexual encounters. So, do those end up sort of balancing each other out? I don't know, but that's something that people bring up a lot. So, no amount of alcohol is safe to drink during pregnancy. That's a message that you all already are carrying with you. Okay, I just wanted to add in just a few other medical complications that came out of some of our FEET presentations for other drug use during pregnancy as well. We already talked about amenorrhea. Spontaneous abortion, we mentioned stillbirth. Actually, I'm not sure what this one is. Thank you. Thank you. It's good to have nurses in the room. Cellulitis, hepatitis, HIV, okay, et cetera, preterm labor, placenta abruptio, intrauterine withdrawal, a number of different complications that can come from using different drugs during the context of pregnancy. And I think a lot of women are aware of, it's bad for me to be using meth when I'm pregnant. It's bad for me to be using heroin when I'm pregnant. And they may not have that same reaction to using alcohol when they're pregnant. Somebody mentioned this a little bit I think when we were talking about why screen, but another reason for screening is just the reality of the postnatal environment. It's not only the impact on the child when they're in utero and those medical impacts, but also what happens, how is parenting compromised if a parent is using? How is attachment and bonding between the parent and child compromised if a parent is using? Both during the pregnancy, how is that attachment compromised, and then after the pregnancy. So another important thing to keep in mind. So compromised parenting often has greater risks associated with it even than the actual medical complications of use. Okay. Another reason to screen, past behaviors are often highly predictive of future behavior. And so if we can learn about how a woman has behaved in the past, we're going to get a sense of what might be happening. And that's why a lot of these screening questions are really based on past rather than present behavior. We're going to be looking, when we look at this tool, on past use of marijuana, the use of alcohol in the month before the woman knew she was pregnant. So again, before she was aware. And then whether or not that woman has ever felt the need to cut down on her use. These are all predictive of continued or future use. We'll look at those. Another reason to screen is, I like the slide on the stages of change, that when a woman walks into, or when we walk into a home visit with a woman who's using during her pregnancy, we have absolutely no idea, unless we know her well, where she is in relationship to her use. So she may be in a pre-contemplation stage where she hasn't even, someone said denial earlier, she hasn't even really started to think about it as a problem. She hasn't really started to think about, this is something I want to change. And so when we broach that subject, we might be met with some resistance or some denial. But we might meet that woman when she's in the contemplation stage, when she has started to think about, oh, what's going on here? And in that case, she may be somebody who's wanting information, who's starting to, yeah, let me know about that. Tell me what's happening there. I mean, what are the effects? We might meet her in the preparation stage, where she's already thought about it. She's got her list of resources. She knows who her treatment providers are. But she hasn't yet made that leap yet. We might get her in the action stage where she is doing something. She started to attend AA meetings or NA meetings or something like that. Or maybe she's in a relapse stage. She's already tried. So I think that's important to know, because I think a lot of people, one of the reasons that we don't screen is that we're afraid of pushback, that the woman is going to be antagonistic or offended or isn't going to want to listen to what we have to say. But we don't know where she is, and we don't know if we get her in the pre-contemplation stage, we may actually tip her energy over into the contemplation stage, and the next time we come back, she may be here. So we're planting seeds that even if they're not manifesting in that first session with her, they may be percolating, and she may be in a different place when we come in the next time, or when the next person encounters her, whether it's her mother or her friend or her boyfriend or whoever. Any thoughts on that, just in terms of the clients and the women that you work with? Okay. Okay. So all good reasons to screen. And, I mentioned one of the reasons why people don't, but when you think about substance abuse screening and how simple it is, why don't people do it? Why don't doctors do it? Why don't nurses do it? What are the barriers, Pam?
Well, if you find something out, you have to do something about it.
Right. Okay. And why don't people want to do something about it?
No time.
There's no time. Why else? Okay, there's no resources.
Don't want to hold that information.
I don't want to be the holder of the information because?
I'm liable.
Okay, I'm liable. Just on a legal level, yes.
They're not trained.
Great.
They're not trained to do this, and so they don't have the tools.
Okay. It's good. Oftentimes we don't. We don't have the tools. We don't know the resources. There may not be resources that are adequate. And so we don't want to open up the can of worms. were fearful of offending. When we did our pilot with the Oregon Medical Group, it was really interesting to watch because we had a couple of nurses who at the beginning were like, no way, I'm not doing this. Like, my clients are going to leave and they're going to be offended, and I'm not going to do it. And then we had a couple of nurses who actually had just come out of school and were like, we'll just say we asked this of everybody. We'll just, we asked this of everybody. Just a normal screening question. Well, by the end, we did this pilot for actually a little bit over a year. By the last focus group that we did, nobody was saying, I'm afraid of offending. Everybody was saying, oh yeah, this is part of our normal practice. And that hadn't manifested. That fear of driving clients away hadn't manifested. We were able to put some resources in place that helped as well. There was just
your own issues.
Yes, that's what I was. Yes, say more about that.
Well, if you have alcohol, drug issues, or if you have a certain belief about use in pregnancy, you may not want to be screening people because you don't think it's important. You may not think it's important, or.
Okay, I think that's a really important one. You may not think it's important, or asking the questions of someone else forces you to ask the questions of yourself on some level, or someone in your family who's in your mind. So it's a risky encounter to be doing this because it takes us to those stages of change. And where are we? And where is our family member? Et cetera, et cetera. I think that's a really important one. Any other reasons why people may not screen? Okay. Okay. So when we're talking about prenatal screening, we're talking about just asking the questions in the right way at the right time. And that's kind of how we talked about it in the context of our pilot. So let's look at what the questions are. The tool that was selected was called the Substance Use Risk Profile Pregnancy Scale. And it's a relatively recently developed screening tool. It was developed at Yale by a number of doctors, researchers, public health folks in the departments of psychiatry, obstetrics and gynecology, the School of Epidemiology and Public Health, the medical school, et cetera, who came together to develop this tool and to study it. It was based on self-report, so it was, when they looked at it, it was a screening questionnaire that was provided to women who reported on their own use. So they answered the questions themselves. I have a little star next to self-report because the authors, when they were developing this tool, they looked at studies around self-report of drug and alcohol use to say, do women really report honestly? And they found that there was very high agreement. They looked particularly at studies around marijuana and cocaine. And they found that with marijuana, the studies they looked at, 75% of the time, if a woman said she was using, her urinalysis showed the same results. The same with cocaine, it was a little higher. It was 79%. We deal a lot with parent self-report in the context of screening, developmental screening where I work. And all the studies show a real high reliability of self-report in that arena as well. But I just wanted to say that because that's something that they thought about and that they tried to look at least. When they were developing this scale, they looked at some existing tools. So some existing substance abuse screening tools. One of them is the TWEAK, which I always have to look at what that stands for always. Tolerance, Worried, Eye-Opener, Amnesia, Cut Down. Some of you may be familiar with that tool. They also looked at the 4Ps Plus, which was a tool developed by Ira Chasnoff. Dr. Ira Chasnoff, out of an existing tool called the 4Ps. He added a question to it, and we'll talk about that in a minute. This Addiction Severity Index, they took a couple questions off that. They looked at some DV questions. And then they looked at which were the questions that actually were most predictive of risk. And that's where they we'll look at the questions they came up with. They also examined sensitivity and specificity of their tool. In their validation studies, so when they were validating the tool, they had a sample of about close to 1,100 women in their sample. And they looked at sensitivity and specificity. And this is going to be relevant when we talk a little bit about how the tool assigns risk. Do folks know what we mean when we say sensitivity and specificity? Does anybody want to take a stab at it? Okay. Sort of. Yep. It's you're getting there. Let me kind of just do a little. See if I can. Okay. So we have a group of women who are being screened using. Can everybody see that? I'm realizing that. Okay. Using a screening tool. And some of them are using substances. Okay. So sensitivity, when you're looking at the sensitivity of a tool, you're looking at, is it, the way I like to think about it, is it sensitive enough that it's going to identify all the women who are using? So if a tool has really high sensitivity, like if it has like 100% sensitivity, really high sensitivity, it might identify, all of these women. So it identifies all of the women, all the pink women, all the women who are using. But when you have high sensitivity, what else might happen? Do you notice what else is happening here? Okay, we're getting some false positives. So when we're talking about specificity, we're talking about, is it specific enough that it puts people in the right category? So it also identifies the women who are not using. So it doesn't over-identify. And what we want is to find a tool that's got good sensitivity and good specificity. But what also often happens is you have to kind of balance the two. So in order to get pretty good sensitivity and pretty good specificity, you're always going to have a little bit of over-identification and under-identification. Does that make sense? Okay. So they looked at sensitivity and specificity. We'll talk about this a little more, but I just wanted to set the stage. And they're doing additional validation studies on it right now. So they're looking at this tool more. They actually had pretty good sensitivity and specificity for when they were looking at a low-risk algorithm, and I'll show you what that means. And then they had, when they looked at high-risk populations, they had the algorithm that they used to assign risk was better in terms of specificity than sensitivity. Don't worry about that too much right now. I'm going to talk about what that means in the context of the tool, but I just want to kind of set the stage for that. Any questions, thoughts? Is that just too confusing? Okay. Sensitivity and specificity. I know it is. You could make up a little song about it or something that would. Okay, so the screening questions that you're going to be utilizing are very simple. There are 3 questions. The first one is, have you ever smoked marijuana? The second one is, in the month before you knew you were pregnant, how many beers, how much wine, or how much liquor did you drink? And then the third question is, have you ever felt the need to cut down on your drug or alcohol use? Okay, 3 simple questions. What do you think of those questions?
On question 2, what are they looking then collectively throughout that month? Are we looking on a day-to-day basis? How frequent in a day would you use?
It's simply in the month before you knew you were pregnant, how many? So you don't have to worry about day-to-day. It's just total.
Is that so that you're not, in a way, also finding like, oh, that you drank intentionally while you were pregnant?
Great.
Opens the door to see if you may have.
Okay, yes.
Because this is the month before you knew.
Okay.
You're not feeling so like they did something wrong. Oh, no, of course, maybe before I knew I was pregnant.
Okay, exactly. And I think this is the question that actually came from Dr. Chasnoff's 4Ps Plus, was he added in and did a lot of research on this in the month before you knew you were pregnant. Did you? And for that very reason, it removes the judgment. Well, before you even knew, how much did you drink? And if they're using in the month before they knew, we know that they were using then probably in the early stages of pregnancy because they probably didn't know they were pregnant until a month, 2 months, 3 months into their pregnancy. I put a star next to this question. The way the authors have ordered this tool is the way it's ordered right here. I put a star because if I were asking those questions, I think I might ask the second question first.
Because?
Why? Any thoughts?
Alcohol's legal.
Alcohol's legal, and why might that be important?
They wouldn't feel like they were at a threat to be arrested or go to jail.
Okay, it's a less vulnerable question. It's less vulnerable because of what you just said, that it's talking about the month before. It's talking about alcohol. It's not as disruptive a question, I think, to ask that first. And then say, well, have you ever smoked marijuana? Have you ever felt the need to cut down? I think can be, you don't have to do it that way, but that's something that I think I would do if I were, yes.
It's interesting to me, I would start with number 2 as well, because it's relevant to pregnancy, why you're having the conversation in the first place. And
Yeah.
have you ever smoked marijuana? Is someone's entire history?
Yep.
And if they did it once when they were younger, is it really relevant to their pregnancy right now?
Okay.
It just seems interesting.
It makes less rational sense or less logical sense to us just looking at them. But it's important to remember that they selected these 3 questions because the answers to these 3 questions actually predicted risk better than the others. So these were good predictors of current risk, just to keep in mind. And we'll look at that a little. Any other thoughts or questions? Or yeah?
I was just going to say, it's striking that the third question, it really gets at the parents, at the mom's value system around her usage.
Okay.
It's asking specifically has she ever felt that she needs to cut down. And
Yeah.
so she could say, yeah, I've smoked marijuana all the time and I had, 40 drinks the month before I knew I was pregnant, but no, I've never felt like I need to cut down.
Right.
So you're really going to learn a lot about her opinions of alcohol and drug use.
Yeah, and I think that's actually really important because not only is this response predictive in assigning risk, but it gives you an entry into how you're going to deal with this mom. Exactly. It gives you a sense of where is she coming from, where is she in those stages of change, what might I move toward in terms of my intervention.
I know maybe not with the older, parents, but for the most part, I think especially the younger parents and teens, asking if they smoke marijuana, most people don't think that's a big deal.
Yeah.
Oh yeah, when I was at this age or 2 years ago. So I think that may be why they picked that, because for most people that's not, they minimize it. It's to them not a big deal, even though it may be, especially with pregnancy or like leading to other drugs. Many people don't believe that.
Yeah. Yeah, and that's going to be knowing your population and figuring out, I think, knowing your population and how they may respond to those. Yeah.
If they say no to the first 2, it seems odd to ask if they're, you know what I'm saying?
Right. It does seem odd, but and when we look at,
I realize there are other drugs.
Yeah, and I think it's still important because they could have been. They could have been felt the need to cut down in the past. Yeah, before they may not have used in the last month. Maybe they were preparing for this pregnancy, or they may be in recovery. But it still can be a good predictive kind of question. I want to go back here and then here, just because I know.
I think it was already said, but question number 3 helps you know, have they been in recovery for 10 years?
That's what. Yep.
And then how can you support that?
Yep. Okay, here and then here.
Do you know, is this a reimbursable screen? We were working with one of our providers with the SAMHSA, and we were trying to look at a bunch of different tools.
Yeah.
And he was working with us to get reimbursed.
I don't know. Do you all know if it's a reimbursable screen?
I don't think it is, but we can follow up and check.
Okay, that's a good question. And then over here in the.
I'm just curious. We've had lots of training the last half on found reliable tools, and that for the validity of it, you can't rearrange anything and have to ask it in the way it's asked. So
right.
Is it still valid if we reorder these questions?
I think it is still valid if you reorder, because even the way that they put them in their report, they were not always in the same order in terms of how they, Okay. So when to ask, and this is my understanding from your regulations, your program, how your program is going to be operating, and some of the folks who are in charge here may correct me if I'm wrong, but my understanding is that you're going to be doing this screening at intake or sometime close to intake. That's going to depend a little bit on your programs. That you're going to be doing it at 36 weeks for women who you're working with prenatally. And then for women who are enrolled after pregnancy, you're going to be doing it again at intake, and then when the child is 12 months. Is that true? Okay, that's the information that I got. Okay, I just want to make sure. So those are going to be the general times in which you're going to be administering this tool. There's some thought or some different ways of thinking about how to ask or when to ask. And my understanding also is that, each of you within your programs or each of your programs may integrate this tool a little bit differently. So you may be integrating it into the context of a existing health screen that you're already doing, so it may be part of the questions of that. You may be doing it separately as a separate interview. My understanding was that's something, when I talked to folks on the phone, that was going to be something that you'd be deciding as programs. But one of the decisions that you'll need to make is, do you do it as a verbal interview or do you do it as a written that parents fill out? The studies that they did on this tool, they did it as a questionnaire. So that's one way of doing it, and that may be the initial way that you want to do it. I think following up, when we did our pilot, and a lot of the research that I've looked at in terms of administering screening tools, is that it can be very helpful to do it also as a verbal interview, because then you have the opportunity to move into a conversation about it. You can also look at it after they filled it out and then move into a conversation. But that's something that you may want to be thinking about. Are you going to be doing it verbally, or are you going to be doing it as a survey? We're going to do a role play where you're actually going to do it verbally, because it's going to allow us to move into a conversation about it. Importance of universal, again, asking every woman, because like we said, we don't know what a woman who's using substances looks like. We don't know where she is in her stages of change. Coming at it from a non-judgmental perspective, that's something that I think you all are well able to do, and we'll talk about that a little bit. And then again, I just talked about thinking about the context or the format. Is it going to be integrated into your existing intake, etc.? Okay. So scoring. The scoring is pretty simple. So after a woman has answered the questions, you review her responses. So have you ever smoked marijuana? She says no. And you ask, in the month before you knew you were pregnant, how many beers, how much wine, or how much liquor did you drink? She says 5 glasses of wine. Have you ever felt the need to cut down on your drug or alcohol use? She says no. So the way this is scored is simply by giving a number, a 1 point, to any yes answer. For question 2, in the month before you knew you were pregnant, how much did you drink? Any alcohol at all is considered a yes answer. So it gets a 1 point. So how many points did this mom get on this screening? Okay, so she's got 1 point on this screening. Okay. When you're looking at level of risk with this tool, 0 points, so if a mom answers no to all of these questions, is considered low risk. 1 point is considered moderate risk, and 2 to 3 points is considered high risk, or what we would call for a high risk population a positive screen. If you were dealing with a very low risk population, the authors suggest that you treat even a moderate risk as a positive screen. But with a higher risk population, they suggest that you do not. Simply because they want you to be careful of over-identifying people, particularly when the issue of child welfare could be on the table. So you don't want to over-identify. Yes?
Specify what you mean by high-risk population.
Well, and this is a conversation that we had with, I had with Karen, and she was a little unsure about whether your group was considered high risk. But I think the understanding is that if a high risk population, if, you know, in terms of income levels, education levels, age of moms, I think those were the main kind of factors that they were looking at. Yeah, it's kind of the general risk factors in terms of use during pregnancy. Cindy?